Let's kick things off. Welcome to this high-energy explainer on Antiemetics. Now, we all know learning pharmacology can be incredibly hard. It's tough, right? So we're packing this with mnemonics, fun memory tricks, and hard-coded English subtitles so you won't miss a single complex medical term. We're going to make medicine make perfect sense today.
We're starting out with a chapter we call the confused neuron, which is a concept you'll actually see referenced in classic heavy-hitting pharmacology texts like Lippincott. Because, well, before we can fix the nasty business of vomiting with medications, we first have to understand the brain's bizarre protective problem. Why exactly is this neuron scratching its head? Let's find out.
Section 1. Anatomy of a puke.
Okay, so think about the path food usually takes. Normal digestion moves in what we call a kata direction. That means it travels from proximal to distal. Smooth, orderly, exactly how it should be. But vomiting? Vomiting is the exact opposite. It's an ORAD, retrograde movement, violently pushing everything from the distal end back up to the proximal end. It's literally a traffic jam going the wrong way on a one-way street.
Now, vomiting isn't just an accident. It's a highly tuned automatic reflex designed to protect you from your environment. It's classical conditioning, or stimulus generalization. Think of Mark Twain's famous quote, "A cat that sits on a hot stove will never sit on a hot stove again, or a cold one either." Your body learns that exact same way, violently rejecting things it thinks might harm it.
So if you think puking is just an annoying bug in our human software, think again. It's actually a genius evolutionary hack. Say you have way too much acid in your blood. What does your body do? It pukes up stomach acid to alleviate that severe acidosis. Or what if you're experiencing hypoxia, low oxygen? Digestion takes massive amounts of ATP and oxygen. So your body literally sacrifices gut digestion, emptying the tank, to save precious energy and oxygen, so your brain and heart don't shut down. Pretty amazing, right?
Section 2. The vomiting reflex arc.
Let's follow this brilliant mnemonic step by step. It's the SRACRER acronym, which hilariously enough means cockroaches in Arabic. It maps out the reflex perfectly. S is for stimulus, like irritating your throat. R is for the chemoreceptors that pick up the signal. A is the afferent pathway, mostly the vagus nerve, firing that signal up to the brain. C is the center in the brainstem processing it. E stands for efferent nerves, carrying the command back down. And R is the final response, contracting those abs, relaxing the stomach, and puke.
The true center of that arc, the C we just talked about, is located deep in the medulla oblongata. It's called the CTZ, or chemoreceptor trigger zone, meaning if you want to stop a patient from vomiting, pharmacologically speaking, you've got to get in the zone.
Section 3. Meet the antiemetics.
So how do we actually fix it? Well, we can literally map specific drugs directly to the neural receptors and anatomical sites we just explored. It's like a beautiful puzzle. Ondansetron blocks serotonin right on the vagus nerve. Metoclopramide blocks dopamine directly in that CTZ area. And diphenhydramine? It blocks histamine in the inner ear to stop motion sickness. You're basically just matching the right antagonist key to the right receptor lock.
Which brings us to a slightly cheeky truth in medicine, one that always gets a good laugh in the clinic. There's a saying, when doctors don't know what to do, they give steroids to you. And honestly, corticosteroids are quite often used as an additive therapy. They really boost the magic of other antiemetics, especially for cancer patients going through heavy chemotherapy.
Section 4. Receptors and mnemonics. All right, memorizing all this can be tough, so let's use a trick for Ondansetron. You need to associate it with a serotonin 3 receptor. Just imagine a bunch of kids getting sick on a roller coaster shouting, "Hey guys, let's all vomit on 3. 1, 2, puke!" It's silly, I know, but I promise you, you will absolutely never forget that Ondansetron blocks the 5-HT3 receptor.
Understanding chemical suffixes is like having cheat codes for medicine, and it's way faster than sitting through a boring 3-hour pharmacology lecture. Check this out. If a drug ends in cetron, bet your rent money it targets serotonin. If it ends in pipent, it's anti-neurokinin. And a quick pro tip, keep a close eye on Metoclopramide. Because it blocks dopamine, it can accidentally give your patient extrapyramidal, Parkinson-like tremors. Always got to watch out for those tricky side effects.
Section 5. The danger of vomiting.
From the old stories of wealthy Romans supposedly irritating their vagus nerves with wooden spoons after a massive feast, to modern clinical presentations of bulimia nervosa, the physical act of purging leaves massive clinical clues behind. For example, you might see the Russell sign, which are excoriations on a patient's knuckles from scraping against their teeth, or periodontitis, which is severe non-bacterial dental decay caused by all that rising stomach acid.
This is exactly why you need to maintain a really sharp clinical sense. Be like the great historic Dr. Babinski. Do a thorough physical exam. Look for the Russell sign. Check the teeth. Don't just be a doofus with a stethoscope who relies entirely on an MRI machine and completely misses the obvious physical signs staring you right in the face.
Because ultimately, vomiting isn't just gross or inconvenient. It can be incredibly deadly. The volume depletion, that loss of extracellular fluid, and the severe electrolyte disturbances can completely wreck a patient's system. Potassium problems will literally cause lethal cardiac arrhythmias. Sodium problems? They'll trigger massive brain seizures. You absolutely have to treat severe emesis seriously to save the organs.
So, I'll leave you with this final provocative thought to test your knowledge. Consult your clinical manuals, crack open those Lippincott textbooks, and really think through the chemistry we just covered. Quiz for the pros. Excessive vomiting is most likely to lead to which acid base and electrolyte disturbance? Knowing the exact disturbance determines exactly how you save your patient's life. Drop